Welcome back, everybody. This is the Now Morning Show right here on TTT, and I am joined by the Minister, the Honorable Terrence Deyalsingh, Minister of Health. Good morning.
Good morning, sir. How are you?
And welcome. And with us, we also have Dr. Hazel Othello, Director of Mental Health. Good morning. So we are speaking on mental health this morning, and everything that it encompasses, and where the ministry stands as pertains to that, and how you are ready to support the public in that regard.
Right. So first of all, let me say, in looking at your previous interview on Calypso, do you know back in the old days when I was young, after Ash Wednesday, you couldn't play Calypso on radio?
Oh. Really?
You see that? Dr. Othello, you remember those days?
I remember that, yes.
You could not play Calypso on radio
Really?
after Carnival Tuesday, 12 o'clock in the night.
Why not?
That is how Calypso was bastardized in those days, and I am so glad those days are over. Same thing with mental health. Mental health has always been bastardized in Trinidad and Tobago. It has always been the ugly duckling of the public healthcare system.
Right.
We never spoke about it. We never put resources in it. We never had policy behind it. And with that came the whole issue of stigma, discrimination.
And misconception.
Misconception that mental health is that you lock away people for 30 years and 40 years and send them in sentence and forget about them. This is the first government that has a cabinet-approved position that treats with mental health and to decentralize mental health once and for all. I've been talking about it since the 1960s, since when you couldn't play Calypso on radio after Ash Wednesday. You didn't know that you're too young, but that's all right.
I learned something.
I'll forgive you for that one. Anyhow, so we are going to, as far as possible in the minds of the public, take mental health out of the shadows where it has been for a century and now shine a light on it and make it a part of the mainstream public health system. And Dr. Hazel Othello is the person that has been charged with that responsibility. What Cabinet has done is approve the creation of a new position, Director of Mental Health. That is where Dr. Othello will come in.
Right.
That was approved in February of this year. She takes up her position from November 1st. So maybe Dr. Othello can now tell you what it is she has been charged with to execute the policy that I took to Cabinet.
All right. Well, that is your cue, Dr. Othello. Please inform us.
We'll do exactly that.
Okay. Ever so often, policies are developed and wonderful documents are written. But somehow that step from documents to implementation is where we seem to get stuck so often. At this point, the ministry is very serious about making sure that that does not happen with mental health this time, so that the implementation process is what I've been charged with the responsibility of getting moving, so that over the next few months, I would have to present to the minister a document which highlights very clearly the steps that we need to take in order to get from that policy document to the point of actually seeing the services that we need up and running, functioning for the benefit of all our communities.
Beautiful. Now, I do want to backtrack a little bit because, Minister, you did mention the old adage, if I will, of having your family members sent to St. Anne's and forgetting all about it. There are many myths, if we will, surrounding the use of St. Anne's and the facilities functions. To the general public, what would be the best update that you could perhaps provide therein?
The policy talks about decentralization of mental health. With that comes new clinical guidelines as to how we treat both the acute patient who presents today with some psychotic break and the chronic patient who needs long-term care.
Right.
St. Anne's has developed into a chronic care model where you lock away people for 30 years. There are people in St. Anne's who know no other home but St. Anne's. And the new model speaks about taking mental health back into the community so people can interact with their community, work once they are stabilized, be a part of the community, have their family support, and so aid them in their recovery from mental health the same way you help people recover from a heart attack.
Right.
Right.
The same way you help somebody recover from appendicitis. The basic philosophy is to have mental health not be relegated to the dark ages and to the shadows on the periphery. With this new model, Dr. Othello will be charged with coming up with new clinical guidelines. With that will be the establishment of a new central facility. St. Anne's will be shut down eventually. But before we could shut down St. Anne's, we have to build some satellite centers around the country.
To house those who are currently there.
Not to house,
Not
to
house,
treat.
to treat, yes.
To treat.
Thank you.
And that is the paradigm shift
Yes.
that we want to get. It's not about housing people. It's not about warehousing people.
Right.
It's about
Treating.
treating people.
And
So
working
I'm so
toward
glad that you and I
reintegration.
are having this little
Yes.
conversation.
So that the narrative would change.
That's right.
Exactly.
That's right. And that is what we are. That is what Dr. Hazel Othello will be charged with. We had a meeting with her yesterday, gave her marching orders. She should now go away, come back to me by March
Yes,
2020, talking about the clinical guidelines and what type of physical facility she will need now to support the new clinical guidelines. So we no longer lock away people for all the days of their lives.
That's right.
We integrate them with their families, we integrate them with their communities. And
And
I am so excited about this. You
That
would
is
not believe. You would not believe. If I could jump up here and hit the ceiling this morning, I would do that.
It's certainly worth being excited
Yes.
about, because when we talk about reintroducing persons into society, that is
Yeah,
progress.
yeah.
But then beyond the St. Anne's facility and the changes that are about to be enacted, how can we as men, women of society help our family members, friends, those who may need support with mental health? Perhaps Dr. Othello can help with this one?
Well, one of the first things we could do is assist them when they need to get care, because very often, because of the stigma, when persons start to develop mental illnesses, they are kind of pushed aside by society.
Right.
If you're depressed, people think you're moody. If you're irritable, people don't want to be around you. If you're starting to develop psychotic symptoms, people think you're weird and you're strange, and they don't want to be around you.
Right.
And so that person is basically outcast from
Ostracized,
society
right.
as in a very different way from the way we would treat a friend or a relative who starts to have chest pain, for instance. And we want people to begin to understand that mental illnesses are simply altered brain chemistry. It's just the disease process affecting the brain, just like disease processes affect the liver, the kidneys,
Also,
the heart,
right.
and any other organ.
Right.
So that patients with these diseases must be treated in the same way. They must be assisted in getting the help that they need. Sometimes that help is medication. Sometimes it involves different types of therapies. And we want to put in place the processes that would ensure that the services that are needed are easily accessible.
You've got those marching orders, so I know they're going to happen. You did mention, though, depression, for example,
Yes.
as one of many mental health issues that plague Trinidad and Tobago society. We don't necessarily distinguish things very often, though. So perhaps you can also elaborate on some of the other mental health issues. So apart from depression, or as the average man might say, even madness, what other mental health issues plague Trinidad and Tobago society specifically?
Well, Trinidad and Tobago is no different from any other society in terms of prevalence figures for mental disorders, with the possible exception of substance-induced disorders, where we have higher prevalences of marijuana-induced and cocaine-induced disorders
Okay.
than a country. Well, I shouldn't say higher, but we don't have the opioid
Right.
addiction
Right.
problem that first world countries are grappling with, in the way that we don't have it in that way, right? We do have heroin addiction to deal with, so that our substance abuse profile is different.
Right.
But in terms of the other mental disorders, we have depression, we have anxiety disorders, we have psychotic disorders such as schizophrenia, we have bipolar disorder, we have, you name it, we have it. We have all the personality disorders that people tend to not know much about.
Right.
We just treat these people as being people we don't want around us because they're difficult to deal with, as opposed to directing them in the direction of treatment.
Where they can get the proper
Correct.
help and, what is much needed and overlooked
Yes.
today. Minister, one question. how is the ministry prepared to regulate even private institutions that perform or at least try to perform mental health services?
That's a good question. The ministry has always been ready because there's something called the Mental Health Act. Under the Mental Health Act, any private institution wishing to provide mental health services as a hospital or a home needs to register. So we have always been ready. The problem is people who start up these facilities don't register,
right?
Which the recent issue of TLM brought to the fore. So we have always been ready, and we will work with anyone who wants to register to have a legal entity under Section 28, I believe, of the Mental Health Act. So we are doing that right now as we speak. But I just want to throw out some figures for you. Globally, the incidence of mental health issues is 1 in 4. In other words, I have counted the people in this studio right now. We have about 15 people. Let's say 16. It means of these 16 people, 4 of us in here, by statistics, will have some sort of mental health issue. Hope it's not you. Hope it's not you. You all look okay to me. Hope it's not the cameraman. But that is the global prevalence of mental health disease, 1 in 4. Right. It doesn't mean 1 in 4 needs to be hospitalized.
Right.
The same way you have over 250,000 diabetics in Trinidad and Tobago.
Right.
It means that with proper therapy, with proper advice, you can live a productive life. And whenever I speak to an audience about mental health, to show you the stigma and discrimination, do you tell somebody who has diabetes, snap out of it?
Right.
You don't.
You don't.
Do you tell somebody who has cancer, it's in your mind?
No.
It's a real issue.
Yeah.
Right.
Same thing with mental health. We tell people who we suspect suffering from mental, well, snap out of it
just
now.
unhappy.
Go and sleep now.
Yeah.
Right? It doesn't work like that. It needs to be clinically treated the same way you treat diabetes, the same way you treat hypertension, the same way you treat cancer. And we don't discriminate against those people.
Right.
But once we hear somebody has a mental health issue, the first thing we say, well, go sentence now.
Yeah.
Right? Send them sentence, lock them away. And the first thing we are going to do now is change the conversation and no longer call it mental health or psychiatry services. It's going to be behavioral wellness services. That's the first main change. It's going to be behavioral wellness. And that is a total paradigm shift away from psychiatry, away from sentence being a madhouse.
Yep, exactly.
Right? That's the old outdated model of having a sanatorium where you send people to live out the rest of their lives in isolation. Those days are going to come to an end. We have been talking about this issue of mental health and decentralization since the 1960s.
Right.
Before you were born and I was 5 years old.
Yeah.
Dr. Othello wasn't born yet, right? It is time, and I'm so pleased that my Prime Minister, Dr. Rowley, when I took the notes to Cabinet to bring us this far, had absolutely no hesitation in supporting every initiative on mental health. Absolutely none. And that is why we have made so much progress in the past 2 years, and we have reached this point, a point, I will say, of no return, where once and for all we take mental health out of the shadows, shine a light on it, and have society see mental health and persons suffering with mental health as no different from the diabetic.
No different from those suffering
No
cancer.
different from a cancer patient.
Exactly.
They need the same empathy, the same support, and the same care.
And the ability to be reintegrated into
And
society.
that is key. Reintegrate. The same way the diabetic isn't sent out to live in the yard. You don't do that to a diabetic. You don't tell the diabetic, well, go and live in the outhouse and stay there for 30 years. But that's what we do to mental health patients in Trinidad and Tobago.
And that is what
we are going to change. Right?
Exactly.
Good.
Well, Honorable Minister, thank you for joining us this morning.
You're welcome, my brother.
Yes.
And Dr. Othello, it was an absolute pleasure having you here as well. Thank you so much for both joining
You're
us.
welcome.
And we look forward to having much more conversation as we chart the course forward.
And I'm excited about the progress of this.
Let's jump up.
That's in detail.
All right, again, joining me this morning, Minister, the Honorable Terrence Deyalsingh, Minister of Health. With me as well, Dr. Hazel Othello, Director of Mental Health, as of tomorrow.
As of tomorrow.
As of tomorrow. All right, we're going to take a short break and come back. Stay with us.